Hi, everyone. Welcome to our Lifestyle Medicine, the New Frontier presentation tonight. Appreciate you taking time to join and learn a little bit more about what lifestyle medicine is. So, my name is Melody Hertzler. I'm a clinical pharmacist and also the owner of Farm to Table LLC and our website, functionalmedicinece.com. And my background is in ambulatory care. So I've been practicing in the diabetes space for a really long time. So that's why I started using lifestyle medicine principles, because I was seeing a lot of people that lifestyle change makes a big impact in their chronic condition. And so I'm also board certified by A4M in anti-aging and functional medicine. So definitely looking forward to sharing this information with you tonight. So objectives, really, we're just going to introduce lifestyle medicine. This is meant to be introductory for people that are newer to this space and what it is and what the relationships of these lifestyle changes are to your overall health. So ideally, we're going to talk about sleep, activity, all of that, and its effect on preventing chronic disease or helping with symptoms. So nutrition is also going to be part of our discussion tonight. So in reality, we have a lot of things that we need to work on in America. So 6 out of 10 Americans have a chronic disease, and 2 of those, or 2 of 4, have 2 or more. So that's like, just thinking about that, it's like, oh my goodness, like if you think about 10 people that 6 of them have a chronic condition. And so these conditions account for about 75% of all healthcare costs. Chronic and mental health conditions are also responsible for 90% of the 3.8 trillion annual spent in healthcare in the US. So while our acute care is really expensive, when if there's a car accident or some kind of traumatic thing, like that's expensive, but it only is a small chunk of the cost the healthcare system is experiencing. And so many of us who are healthcare providers, and if you're not a healthcare provider and you're listening because you're an HR manager or you're trying to help your company reduce healthcare costs, you see the other side of it. But we know this existing fee-for-service model of healthcare and the prioritizing symptom management with medications over treating the root cause through changing behaviors is just not sustainable for the long haul. And so that's really what our team is about, and what our company is about teaching and educating and getting people to address those root causes so that we can have decreased healthcare costs, as well as ultimately better longevity for our patients. And in 1993, which seems like a really long time ago, a study in JAMA said that 80% of premature death in the United States was because of poor lifestyle. So that's over 30 years ago that we were and I'm dating myself because I'm older than that, but over 30 years ago, we were already talking about, well, we weren't because I was in elementary school, but they were talking about this impact that we're seeing with lifestyle modifications and how poor lifestyle is contributing to premature death. So I think the sad part is that we haven't seen a lot of progress in that in this time period. I mean, yes, there's more technology available. There's more, I think, education, because in 1993, people couldn't look things up online. They couldn't look up recipes. They couldn't, find a Facebook group with healthy lifestyle changes. So we definitely have more access to be able to make changes, but we're definitely in a place that is not too dissimilar than that cost, picture that was happening back then. So as far as chronic disease risk factors, unhealthy diet obviously is a big risk factor. Physical inactivity, we're going to talk about, is a huge risk factor. And then smoking, high blood pressure, obesity, our costs go up for employees or individuals in the healthcare system with every BMI category increase. And then we also have diabetes, which we know is very costly to healthcare system. Even things like air pollution or chronic disease risk factors. The pesticides and toxins can be a part of that picture as well. And the water supply, we know they had the Flint water issue, but there's even, that's just one particular thing. There's so much else out there. Farming communities often are hit with a lot of these pesticides. And then the depression rates can increase. So depression is sort of like a bidirectional risk factor. So like, for example, with diabetes increases your risk of depression, but depression also increases your risk of diabetes because you're not as likely to make good lifestyle choices. You're more sedentary, et cetera. So there's, lots of people that have both. And so we really have to address the mental health toll that is taking place in the chronic disease epidemic. So high cholesterol, chronic disease risk factor, and then excessive alcohol use. And so lifestyle medicine, abbreviated as LM, sometimes is a medical approach that uses evidence-based behavioral interventions to prevent, treat, and manage chronic disease. And it emphasizes disease prevention over curative medicine. So our goal is to prevent these things from actually happening. Besides, we also, have data, we can reverse things with this lifestyle approach, but we really want to emphasize that prevention is the key. It is so much easier with someone with prediabetes to prevent them from going to diabetes and reverse the insulin resistance when we're in that place than it is when we have full overt diabetes, because there's a lot of cellular processes in the body that have this memory. And in that memory, we end up, there's more problems, and some of that is harder to correct the longer and longer someone has a chronic disease. So we definitely want to make sure that we're doing that sooner. And so we're going to emphasize disease prevention over curative medicine, and we're going to focus on empowering the patient and enabling them to participate in their well-being. So much of our healthcare system, the patient is a passive recipient of care, and that is just not going to work, right? We need people to be active, engaged, empowered. I love the word empowered because I think that takes on, this just feeling that you as the provider are not the one responsible. You can educate, you can help them along the way, but the patient has to be the one to actually go home and make these decisions and actually be able to follow through with the lifestyle modifications. And so obviously there's lots of different layers of what that looks like in different populations. We're talking about like a low health literacy population or even a low income population. We have, different diversity factors that are going to be at play and how we can empower the patient and what resources they need. But I think the key is the patient has to feel that they have power. And even some of the things that I love, I teach a lot about continuous glucose monitoring. And that is like the one piece of continuous glucose monitoring that I found to be most successful is the fact that the patient now has control where they didn't have control before. Before they didn't know what was happening. They couldn't check their blood sugar all day. Now, when they can look at our phone app and see what their blood sugar is, they know, oh, wow, like I need to go on a walk to help bring that down after my meal, or I shouldn't eat that oatmeal plus a banana plus orange juice for breakfast because that skyrockets my blood sugar. So just empowering them to know that they have the ability to change things. I mean, it speaks volumes for their, ability to maintain that lifestyle. So that's just one small example of how we can use technology as an empowering tool as well. And then it's really one of the fastest growing medical specialties in America. And we'll talk a little bit about how providers feel about lifestyle medicine. But I think it's definitely one of the things that we want to encourage and continue to teach because it's one of the things that is just continuing to pick up. And so pillars of lifestyle medicine, and I'm using the term lifestyle medicine because I think that is sort of our low hanging fruit. There's different terms like functional medicine, integrative medicine. Some of those modalities get a little deeper into, supplementation and lab testing and lots of different things we can do to reverse chronic disease. But these are really just the pillars of where we need to start with every patient. And that is nutrition, physical activity, stress management, getting restorative sleep. I can't tell you how many people come in and they're like, oh yeah, I'm only sleeping 4 hours a night. And it's like, no, I cannot help you reverse all of these symptoms that you're having until you're sleeping. Sleep is like so key to a lot of the stuff that we have going on in our bodies. So restorative sleep, we cannot emphasize enough. And then social connection is so important. If we haven't learned anything post-COVID pandemic, then, social connection is just so important because we saw the mental health numbers just continue to rise when people were so isolated. And so I think it hopefully was a reminder that, yes, this is key to health. And unfortunately, I think there's a lot of lessons that we learned during COVID that the healthcare system in general is still trying to figure out how to fix, but hopefully that is one on the list. And then avoidance of risky substances. I know that seems obvious for a lot of us that are providers or even in the employer health space, but there's still a lot of people that are smoking. I had a recent patient that paid, cash to come see me And she wants help with her hormones and help with her gut health and all of this. And her thing that she was still holding on to is cigarettes, and she's smoking a pack or two a day. And I'm doing blood work. She's got cadmium toxicity, all this stuff. And I'm just like, okay, this has to go. All of these things are not, and to be in alignment and to be really having your full, embodiment of your full self and to be able to thrive, like this substance needs to come out of your life. And so she's not a place where she's going to make that decision today, but that's where the education and empowerment and all of those kinds of things still are going to be pieces of the puzzle. So these are my core things. Even if I am going to dive deeper with a functional or an integrative type approach, these are the core lifestyle pieces that I have to make sure are in place for our patients to be able to succeed. And so when we look at the health or not having as much health, so less health equals more cost. So when we look at lifestyle health risk factors, we have overweight and obese patients. We have, again, those smoking patients. We have physical activity, behavioral health, sleep. And a person that has diagnosed diabetes costs $10,000 more per year on a health plan than someone without the condition. And the medical cost for someone who has obesity is over $1,400 higher than someone of a normal weight. So every increase in BMI, like I mentioned before, has about $800 more in medical spending per person per year. So it just continues to increase. So that how weight loss has become like the topic of 2023, 24, this, post-COVID era. I mean, we learned that even obesity was a huge risk factor for the immune system. And these people were having more likelihood to have severe COVID and hospitalized and more likely to have death. So obesity is not just a problem for the cost of today. It's a problem for this future cost associated with immune system function, and even just preventing other acute things from happening, whether it's flu or COVID or whatever the next virus is. We need to make sure our patients are able to fight those off, and immune systems are not healthy when we have that inflammation going on from obesity. So also in the workplace, we know that improved healthcare spending and a focus on disease prevention, healthy populations, and reversing chronic disease early in its course can be impacted through lifestyle change. And so when employers are looking at creating value-based plans, we really want to make sure the requirement is that all patients with lifestyle-associated chronic diseases attend comprehensive, individualized, tailored lifestyle medicine education programs administered by quality certified professionals. We want to make sure that we're including reducing polypharmacy. If you're a pharmacist listening, you know that that's a big hot topic, is helping, we see MedList. I mean, I've been working in primary care for my entire career, and there's sometimes that these MedList of patients, a lot of Medicare patients, people, even in the employer space, are 20, 25 medications. And it's like, okay, we know that the reason why a lot of new things got started is because these old things weren't working, but sometimes they leave them on, and then we continue to, add more medications without taking those off. So we need to make sure that we look at that and have pharmacy involved in helping determine which ones we can deprescribe, which is another term we use to talk about decreasing medications. Some of the big ones that I try to deprescribe right off the bat are things like proton pump inhibitors. So those are probably, I would venture to say, one of the worst medications on the market. Yes, we do need them in severe situations where someone has like erosive esophagitis, which is like Barrett's esophagus, maybe precancerous cells that, are caused from this excess acid. But for most of the other people, it's only worsening their gut microbiome and their ability to absorb things like calcium and vital nutrients like iron. And so we get these patients that are iron depleted, calcium depleted. Now they have osteoporosis. Now they have fatigue, severe fatigue. I had one patient recently with like a ferritin of 6, which is, it's crazy. Like the normal should be like 75 to 150. So we have a lot of work to do across the healthcare system. Like if we could only look across all primary care and, look at these patients with that just one category of med, we would find so many places we can improve their nutrition and nutrient status. So polypharmacy is huge. And then reducing the need for novel agents and polypharmacy by reducing disease severity with adjunctive lifestyle treatment. So if I can take someone that's costing the health system a lot because they have a severe, let's say, ulcerative colitis flare, they're on biologic medications, But if I can take them and pull them into a program that talks about lifestyle medicine, has even more some functional components like addressing the microbiome and how nutrition impacts your condition, maybe they don't need the biologic anymore. Maybe they can step down to another therapy. And so there's lots of cool things happening in this space with employer health programs to go out and target those patients, and those patients that end up costing, especially self-insured employers, a lot of money. So, and then also, primary care for chronic condition management needs to be considered as part of the expanded wellness provision. So we not only need to empower the patient to have these additional services and lifestyle support, but also engaging primary care in that process. And I realize that can be challenging depending on the setting and depending if the primary care is part of a health system or not part of a health system, and where, what kind of technology used to engage. But we definitely want to make sure everybody's on the same page there. And then lifestyle interventions within the workplace can result in both monetary ROI for the company and improved health for employees. So that's the thing about this, is that it should be a win-win for everyone. The company should save money by investing in lifestyle medicine, and then also a patient should be healthier, which is going to speak volumes for them as well for participating. And so, as we look at the validation of lifestyle medicine, there was a study that was the diabetes prevention program, which is well known, but we know that lifestyle medicine in that study was more effective than metformin when given to patients with prediabetes to prevent the progression to type 2 diabetes. And then we also know that in the lifestyle heart trial, patients with pre-existing coronary artery disease who use lifestyle modalities can often reverse their coronary artery stenosis. So definitely things that are big deals, because we know even our drug therapy has some decreased risk reduction when we're talking about using statins, but it's not always the end all be all. And again, can we pull this together with some of those other interventions? So in the PREDIMED study, the primary prevention of cardiovascular disease with a Mediterranean diet, and patients were supplemented with extra virgin olive oil or nuts, the study group reported 30% reduction in primary endpoints of myocardial infarction, stroke, or death and from cardiovascular causes. Like, we don't have a statin study that shows us that. We don't. And so the number one thing that we can recommend to patients is to have an anti-inflammatory diet. And, the extra virgin olive oil is huge. I mean, some cardiologists will talk about like drinking it with a spoon, which I can't get behind. The pepperiness of it is really challenging to get that down, but you can definitely have them use that for cooking, drizzle on vegetables, have some other flavors incorporated, but that's definitely a huge thing to consider. So, and then association of daily step count, I mean, we talked about people need to be active, but the fact that there was nearly a 70% decrease in death rates for individuals who walked over 10,000 steps or more compared to those who walked 2,000 steps, like, that's just mind blowing to me. Because again, like, we don't have drugs that can do this, right? Same thing with the metformin versus the lifestyle modifications. Like, the lifestyle modification always wins, and we just need to be educating and helping people understand and allowing them to have workplaces as well that you can go take a walk. My brother-in-law was telling me about his job and how he was at one position and he transitioned back to a previous position, and they were like, wow, you've lost weight. And he was like, yeah, I didn't have to drive in every day an hour. He lives an hour from his employer, and he could work remote, and he was able to go out and take a walk at lunchtime and come back in, or go for a run. But when he's in the office, like, they're having meetings over lunch or other things are happening. So part of it is the employers that are doing employer health programs like this, creating the environment for people that they can take that step to have the wellness piece of their life, whether it's they get to leave early a couple days a week to do an activity. I've heard of that before. Or it's encouraging fitness classes at work. I heard about one company last week, someone was telling me about, they built a CrossFit gym in a manufacturing facility. So there's the sky is the limit depending on what the company size is. But I think the biggest thing is to get people moving and to encourage them to do that. And maybe sometimes that provide from an employer standpoint might need a little bit of incentive, but there's lots of reasons to consider doing that for your employees. So, as far as other things to think about, so this particular study was an impact of 8 lifestyle factors on life expectancy. So this was 8 low risk lifestyle factors. They were adhering to a whole foods, plant-based diet, plant predominant eating pattern, which means that more vegetables than meats, and then having regular, consistent physical activity, managing that negative stress. And that's a huge component that we talk to our patients about day in and day out is how do we become more resilient, because we're not going to get rid of stressors in our life. The world is still going to throw things at us, but how do we manage that? How do we take pause, do the deep breathing? Maybe we do things like acupuncture or massage or whatever that other tool is. Maybe it's cognitive behavioral therapy, but addressing that stress. Not smoking, getting restorative sleep, which often comes with no excessive alcohol consumption. Alcohol messes up sleep patterns and doesn't allow you to have restorative sleep. So a lot of people that end up having this glass of wine, or this whole pandemic phenomenon was like everyone was drinking wine at 5 p.m. online or 6 p.m. So that kind of happy hour, virtual happy hour was happening. But again, that influences our sleep patterns. Certainly opioid use would cause a worsening risk factors as far as healthcare costs. So we want to make sure a low risk lifestyle includes no opioids, and then having a positive social interaction. So there's all kinds of studies about positive social interactions and how that impacts health. And so we want to make sure people have those experiences. And so this all low risk lifestyle factors were associated with a lower risk of premature mortality, and combination of low risk lifestyle factors demonstrated a continuous and graded effect. So the comprehensive adherence to all of them could prolong life at age 40 by 24 years for male veterans and 20.5 years for female veterans. This study was done in the VA, compared to those who adapted 0 low risk lifestyle factors. So if they did all 8, the estimate is that they would prolong their life by 24 or 20 years, depending on if they were a female or male. So this again speaks to, how important this is. And when people are asking for, and so many people come in and they want a drug or a supplement or something quick to fix whatever it is that they're dealing with. But we have to shift the conversation for patients and help them understand what, whether it's substances, food, or lifestyle can be doing to their body, and provide more education upfront at this, in the midst of, helping frame a job and a lifestyle that allows for these things to happen. So speaking of food, when we think of food as medicine, when we're talking about that, we're talking about a whole food, predominantly plant-based diet that's rich in fiber, antioxidants, and it's nutrient dense. So I always think about when we were in high school, how they had these 100 calorie packs, and thinking that was like the good food to be eating when you pulled out this pack and it was like cardboard Oreos, and you thought, oh wow, I'm doing something good for my body. In reality, that was probably it was terrible, right? And there's no nutritional value in that. And so now, we're talking about, it's not necessarily a calorie is a calorie. It's about the nutrition and the signaling that plant gives you. So when you eat 100 calories in avocado, while that may be much less than something else, it is providing you with much greater nutrients, and doesn't spike your blood sugar and all those kinds of things. So we also want to make sure we're minimally processing our vegetables and fruits, whole grains, legumes, nuts, and seeds, and make sure that we're, getting that good support for the microbiome. And then there is data that increased intake of plant foods reduces risk for cardiovascular disease, and also causes beneficial changes in cardiometabolic risk factors, lower total cholesterol, glucose, BMI, inflammation, blood pressure. And then when they looked at health effects of dietary risk in 195 countries, this was a study over from 1990 to 2017. So they saw that there was 11 million deaths were attributable to dietary risk factors, and 3 primary dietary risk factors were found. And one is high intake of sodium, accounting for 3 million deaths, and then low intake of whole grains and low intake of fruit. So the interesting part about this is like the whole low intake of whole grains. Is it really the grains, or is it the fiber that we're missing? Like, would it matter if it was from a grain or from something else? But in the sodium too, I think there's probably more to that story as well. Like, we have sodium is a needed mineral in our body, but obviously too much can be too much. And also, generally, what we're eating that has high sodium also is heavily processed and fills our diet with things that aren't those good polyphenols, antioxidant things. So So I think there's a lot more to uncover there, but important data nonetheless. And the Predimed study also again saw 30% reduction in primary endpoints when using that Mediterranean diet. And then there was another one called the Lionheart study that saw a 50 to 70% reduction in secondary prevention of heart attacks and associated outcomes using a Mediterranean diet. So anytime we're talking to patients, we're always talking about the Mediterranean diet and making sure that they have resources to that. And some, organizations like Institute of Functional Medicine call it the cardiometabolic diet. And so that's a place to start as well with patients if you have access to those toolkits. And then as far as physical activity, exercise improves about every piece of the puzzle as well with chronic disease. So we know exercise, specifically resistance training, helps with insulin resistance. In this particular study, they saw exercise improved cognitive function in both mild cognitive impairment and dementia. And so in mild cognitive impairment, exercise yielded moderate improvement in global cognition, nonverbal memory, attention, executive function, and working memory. So if we're thinking about people that we are employees that need to have good executive functions and working memory, this exercise is important. And then also improved verbal memory and memory processing speed, but to a lesser extent. And then even in dementia, there was a positive effect of exercise on global cognition, executive function, nonverbal memory, and working memory. So definitely something to consider. And also with exercise, we have the cardiovascular. So from a diabetes standpoint, we have improved cardiovascular function with the cardio type exercise. And so we decrease inflammation with that. But then from a long-term standpoint, we also need to have the muscle building exercises and resistance training component as well. So we could pull data all day long talking about how exercise improves all different kinds of chronic diseases, but I think most of us know that. And it's really just, helping, for me, is helping figure out what patients can do exercise. If there, no injuries, we have a lot of options, but if there are injuries, how do we get them moving? If they have knee pain or they have back pain or a previous back injury, what does that look like? Sometimes that looks like physical therapy to help understand and assess the situation and see what exercises they can get to them. Maybe that's more of a recumbent bike versus a regular bike, or, different modified versions, but working with professionals that are trained in fitness and trained in, physical therapy can be really important to creating those types of programs. And then stress management. So I always say that we are designed to have this stress response for a reason, right? If we're running for our lives or running from a bear, we need our heart to start beating and we need to get that blood pumping so that we can run. The problem is that in today's society, we are chronically running from a bear. And so we are always in that fight or flight. I wouldn't say every single person, but there's a lot of people just in the constant move, 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 move. And that causes this overactivation of what we call the sympathetic nervous system and causes elevations of cortisol levels, which lead to changes in gut function and also lead to changes in our cardiovascular health, as well as downregulation of immune function. So when we think about, again, keeping our workplace healthy, stress management is a piece of that. So when people are calling off or not showing up, that's because of poor immune function, but we can definitely downregulate that when we have chronic stress. So stress can also result in disordered sleep. So we have patients that their cortisol is, normal the rest of the day, and all of a sudden at night it's really high, or it's just really high all the time. So that is something to consider with our patients. And then as far as inactivity, if someone's really stressed out, sometimes they can't focus, they can't get their work done in a timely manner, so then they're not able to take the steps to do that extra lifestyle modification of going for a walk. And certainly things like going for a walk, spending time in nature, are stress reduction modalities. So other things can include biofeedback. There's some great tools for that. Great meditation apps that are available now, and even mindful movement like yoga or Tai Chi can really help people settle in on their just thinking about their breath or thinking about certain muscle movements and not be focused on the stressor that they were thinking about. So certain people, it takes a lot more to get them into that calm state. Sometimes it might take going actually to a yoga studio where there is very quiet, very specific regimen happening, versus in their house where their kids are, running around. But sometimes maybe they just need to find a quiet room to do meditation or biofeedback. So lots of different options, but patients do have to, again, be empowered to do this for themselves. Because I think if we just say, you need to do this, it doesn't actually get done, a lot of times. So we need to make sure that they have the resources and the time in their day to be able to do that. And then sleep. So inadequate sleep causes sluggishness. We've all been there. It's something that we have to deal with. And then low attention span, so people can't focus in their meeting. I always think about, if you've seen the Friends episode where Chandler like accidentally commits to going to work in like Kansas or something like that because he didn't sleep and he's just like falling asleep during the meeting. So that kind of thing, if that's happening in your workplace or wherever you are, so you want to make sure people are sharp and know what's going on. And then a lot of times when they don't get enough sleep, they don't want to be social. They're depressed. They have decreased daytime caloric burn. They have increased hunger. So their leptin is higher the next day, or their ghrelin hormones that are actually telling them they're hungry are higher when they have this decreased sleep. And then insulin resistance starts to set in. There's some studies that even like a few days, a week of poor sleep can lead to this insulin resistance to start kicking in, or poor glucose. So it really tells you how quickly sleep can be an impact on the body. And then also decreased performance, not only physically, but mentally. So we've got both pieces there. So most people, employees need 7 to 9 hours of sleep nightly associated with optimal health. And then they also have lifestyle medicine focuses on sleep hygiene, so helping people to have the tools that they need to go to sleep. And then cognitive behavioral therapy can be also effective for insomnia as well, if medications are either not wanting to be used, or maybe we're trying to prevent that, or trying to come off of that. Cognitive behavioral therapy may be an intervention that's helpful. But really, a lot of times balancing the stress and using some of these different stressor techniques that we talked about can speak volumes for sleep too. Getting off blue lights, which I know we're having a webinar here at 8 p.m. Eastern, so people are often having those, or whatever time zone you're in. But I think sometimes we end up doing things on our computers late at night that causes us to be more in that wide awake state as well. So lifestyle modifications, sleep hygiene can really be important to improving this. Again, there are special situations where people have had traumas, or PTSD, or things that might necessitate using medications for a period of time. But for a lot of our population, a lot of these lifestyle interventions are going to go a long way. And then the social connection piece. So there's the National Academy of Sciences created a 2020 report titled Social Isolation and Loneliness in Older Adults. And so social isolation actually was associated with a 50% increase in risk of developing dementia. And then loneliness among heart failure patients was associated with a nearly 400% increased risk of death. And then poor social relationships increased risk of coronary artery disease by 29% and 32% increased risk of stroke. So obviously there's a lot of other factors that these things probably created habits of eating or doing different things, or not doing different things if they were depressed. But it definitely speaks volumes to the fact that social connection needs to be a part of our plan for patients. And then as far as avoiding risky substances, I think this is the obvious one, but tobacco and excessive alcohol consumption. And even, I know we say excessive alcohol consumption, but even one drink a day or over a certain number of drinks a week has been shown to increase breast cancer risk in women. And so I know that in the Mediterranean diet, that wine is definitely something that is part of that diet and does have anti-inflammatory nutrients, but we can also get resveratrol, the nutrient from wine, in a different place if that's something that people struggle with, or it's impacting their sleep or other things. So oftentimes coming off of substances that they're addicted to, especially tobacco or alcohol, can take time and do require often many attempts with the right support to really stop those risky habits. But this is where different health plans can come into place for patients, whether they're choosing a drug therapy plan, or there's some really cool things in the space of tobacco cessation with even like hypnosis and doing different cognitive behavioral therapies to help patients address those types of habits as well. So it's not always just, hey, I want you to quit. Like with my patient, there's going to have to be some different aspects that she's going to have to consider to be able to put the right effort towards getting past that habit. And then briefly speaking on burnout. So Burnout is a national problem, and it is something that is a combination of emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. It was 44% in 2017. In 2022, it was reported to be 66% among healthcare professionals. So obviously, that's after COVID pandemic and all of the things that went down there. But it's definitely I mean, it's continued to on the rise. I see pharmacist groups all of the time, commenting that they don't know how much longer they can do this. I, talk to ER physicians, and they're also, burnout with the system. And so we're going to be at a national crisis of not having the right healthcare professionals in the right places when we are, at this breaking point. And so this is a time we really have to consider, utilizing lifestyle medicine, not only for our patients, but our providers as well, to make sure that they are healthy and able to serve in this capacity. So, this was a study that looked at lifestyle medicine practitioners implementing a greater proportion of lifestyle medicine experience. So, 90% of them reported lifestyle medicine positively impacted their professional satisfaction. So, using this as a provider helps them to be more satisfied with their practice. And then practicing more lifestyle medicine was associated with 43% decrease in odds of experiencing burnout. And then, so the top reasons for positive impact were the professional satisfaction, sense of accomplishment. They felt like their patients were actually getting better, so that was meaningful to them. And then enjoyment of that, spending that time engaging and developing relationships with patients, teaching and coaching them. So they really felt like that helps them personally get better quality of life and balance as well. So I really feel like this is just number one reason to incorporate this more across primary care and even specialty practices, but just to be able to have people, and I realize the payment model and all of that, we need to look at how that impacts that. But this is, reason for us to have those discussions and figure out a place to put this in the majority. I mean, all of our primary care practices should be using lifestyle medicine. It's just that a lot of how the system is set up is not giving them enough time to really do that, or resources. So that's where things like chronic care management, remote patient monitoring, if we could train our chronic care managers in our family medicine offices to provide CCM in a lifestyle medicine component, I mean, that would be huge if we could, develop that. And so that's something our team can provide, but other, whether you're pharmacist, nutritionist, can work with primary care to address some of the gaps that they have in their traditional model, because they are still dealing with acute illness and more urgent needs oftentimes that need to be evaluated. But in the long run, from a chronic disease standpoint, this is really where it needs to be. And so this was a quote from the article: "The practitioner discontent may result from utilizing standardized medical practices do not address the root cause of disease, but rather manage symptoms or sick care. And it's an inability to resolve chronic disease using pharmaceuticals or other standard treatments may impede the practitioner's ability to feel a sense of accomplishment. Yet there's not much research addressing this concern." So again, like most of our healthcare providers went to school to help people feel better. So they wanted to get people well. And if I interviewed all kinds of pharmacy students during my career as a faculty member, and it was always like, I want to help people. I want to help people. And so many people, practitioners, nurses, doctors, pharmacists, even nutritionists, feel like they're not even able to do that anymore because of how the system is set up. So this is just a time where we need to take a stand, both as providers and as employers, and say that our patients deserve something better, our companies deserve something better, our practices deserve something better, and be able to address, using lifestyle medicine to help everybody get to a better, ultimately thriving state of being, instead of in that survival mode. And so we are doing a cruise this summer to be able to help promote this awesome practice modality. And so we are calling it Shifting the Healthcare Paradigm with Lifestyle Medicine. And this is from July 12th to July 19th. And we are leaving Seattle and returning to Seattle. And we are going to have 14 hours of CE. It's family friendly. My kids are going to be there, and our team, a lot of them are bringing kids, and it's just going to be a really great time. And we are covering topics more in depth than tonight, obviously. So we're covering foundations of lifestyle medicine. We're talking about personalized nutrition. We're talking about autoimmune and the stress HPA axis. We're going to be talking about weight management, how stress in the workplace impacts their, employee health, and also some of the future of healthcare things. We're talking about GI wellness. What are the basics we need to do for our patients to influence the microbiome? And then coaching is going to be a conversation as well. We have one of our fabulous health coaches that's coming, and she's going to be talking about how do we guide patients to effective coaching. And then if you're in the employer health track, how coaching is really a key part of this behavior change to get people on the lifestyle medicine changes. So we just got a whole great plan, and you can find more information out about this on our website. I'll put our website link to it in the chat. And then if anyone has questions, if you are thinking about coming or want any more information, feel free to reach out. But this is the link to the actual program. And so we collect the CE fee there. If you're listening tonight and you're interested, definitely check out that page. And then the page also has something there in the middle of the page where you can click on it says see details about the cruise. That goes over to continuingeducation.net, and I'll link this one in the chat as well. But this one is where you're going to talk to them about booking a room. So they will give you a quote on the room. And I am not a travel agent, but I do know, rates are going to vary depending on if you're picking a room without windows, but they have some really cool TV screens that you can see pictures of the outside, just like the cruise staff see in the lower regions of the boat or lower levels of the boat. And so you can still get a really good experience from that point as well. And there are activities for all families. I mean, your meals are included with your cruise rates, and breakfast, lunch, and dinner. Alcohol is not included, but general like tea and water and things like that are. And excursions, there's a couple different ports that you could, book excursions for. You can do things on your own. So if you have questions about some of that, they can help you with that as well. But I'm excited. This is my 50th state to go to. So that's part of the reason why our team was like, we're going to Alaska. But so I'm excited to see everyone there. And I just think, thinking about Alaska as the new frontier, I really feel like lifestyle medicine is really where the new frontier is from a healthcare standpoint. So we're excited to partner with all of these awesome groups and get the word out there and get more people to this event. So if you have questions about it, feel free to message me, but we would love to see you in Seattle and take this journey together. And what to expect, again, we're going to have engaging discussions. We're going to have hands-on workshops. We're going to have networking opportunities. Obviously, you're going to see the beauty of Alaska as well. And this is for healthcare professionals that want CE. So we do have the CE track that will include pharmacy CE, nursing CE, physician CE. Even dentists can get CE through the interprofessional program here. So lots of healthcare professionals. And then also, if you are a person in the employer health arena, we do have CE for HR directors. And but anyone is really welcome to join and learn about lifestyle medicine. So even if you're just a wellness enthusiast or a fitness coach or some kind of leader that just really wants to learn more about it, we want to empower everyone to take these approaches and be able to improve their own health as well. So you can visit our website for more information about that. And again, this is, this is a quote from the person here at the bottom, but basically physicians, nurses, nurse practitioners, physician associates, pharmacists, physical therapists, occupational therapists, dietitians, all of these providers can really need to work together to seamlessly incorporate these elements of lifestyle medicine, and with the clinical goal of health restoration. So helping people restore their health, get to the point of thriving. It is what patients need, and they are exhausted by increasing quantities of costly pharmaceuticals and procedures, and they want and deserve better health. So definitely would love to talk to you more about lifestyle medicine. So if anyone has any questions, I'll stay on for a few moments. You can use the Q&A, or you can use the chat. But thank you for your time tonight. I know giving up an hour or so at bedtime or whatever time it is for you is definitely important. I know there's a lot of things going on, so I appreciate that you took time to listen tonight. Awesome. Well, it doesn't look like we have any questions. So hope you all have a great night and hopefully we'll get to see you in person this summer. Again, if you have any questions, feel free to reach out on the contact form on our website at or FXMed. I'll put it in the chat as well. You can reach out at fxmedce@gmail.com. There you go. Awesome. Take care and I hope you guys you can use something from this to help your practice or your own journey.